We're here at SRUC's Barony Campus Dairy Herd, where we're going to talk about visual indicators of nutrition to assess the adequacy of feeding. The first thing that we can look at is the manure. So the manure will tell us a lot about the quality of yesterday's feeding. Ideally, the manure should form a pile about 1 to 2 inches high and should be of porridge-like consistency. When a cow is dunging, it should sound like a slow hand clap, like this. The diet will have an influence because if we're feeding particularly wet silages, then the manure can be a bit looser. Other things that will cause the manure to be loose is feeding an excess of rumen degradable protein. It can also happen if we're feeding a low forage to concentrate ratio, when we've got a high passage rate of feed through the gut, and when there's acidosis present. On the other hand, the manure can be too stiff, and this may be due to not feeding enough protein. Really stiff manure could also be due to a water availability issue or feeding particularly high fibre diets. So we'll tend to see more stiffer manure in dry cows that are typically fed a much higher forage and higher fibre diet compared to the milking herd. In a herd that is 100% TMR fed, so not receiving any concentrates out with the feed pass in the parlour or robot or out of parlour feeders, then the consistency of manure across the cows should be fairly consistent. However, in a herd that's fed to yield and receiving extra concentrates depending on the level of milk production, then there could be quite a variation in the consistency of the manure. Nutritional causes of scours can be due to ruminal acidosis or a very high passage rate of feed through the gut and excessive fermentation of carbohydrates in the hindgut. Any manure that has a foamy appearance or bubbles in it will indicate rumen acidosis or extensive hindgut fermentation. With extensive fermentation of carbohydrates in the hindgut, we might also see mucin or mucin cas in the muck, and this indicates damage and inflammation to the large intestine. Any of these signs do need investigating and the ration adjusted accordingly to make sure that we improve rumen function and rumen health. We can also look at the content of the manure, either by eye or by sieving it. We do not want to see forage particles over ½ an inch long, as this can indicate that the cows are not ruminating as well or digesting their feed as efficiently as they should be. If we do see long fibre particles in the manure, this can be due to feeding very high fibre forages or forages that have not been particularly well processed. We might also see some grain in the manure. Again, this can be due to acidosis and a fast passage rate of feed through the digestive tract, so the cows are not getting enough time to fully digest their feed. However, we can also see grains in the manure if they have not been processed sufficiently, and also when feeding high dry matter whole crop where the grains have not been processed by the harvester. The next thing that we can look at to try and assess nutrition is rumination behaviour. So cows will spend on average between 7 to 8 hours a day ruminating. We can monitor the time that cows spend ruminating with activity monitors such as collars, ear tags and boluses. And any drop in rumination can be due to acidosis or ill health with a cow off her feed. So rumination can tell us a lot about cow health and rumen efficiency. In the absence of technology to monitor the time that cows spend ruminating, we can also look at their cudding behaviour. So ideally, we want to see no less than 60% of cows lying down chewing their cud. We can also look at counting cud chews. And ideally, we want to see a cow chewing the cud somewhere between 60 to 70 times before she swallows that cud. If the cud chews are significantly higher, then that can indicate a very high fibre diet and poor quality forage, which may be restricting milk output. If, on the other hand, cud chews are quite low and round about 50 or less, this can be a sign of acidosis and a low forage to concentrate ratio in the diet. There may also be cud balls present with acidosis. This is due to the acidity of the cud and its reduced palatability. We might also see cud balls where we're feeding particularly wet silages that are very acidic. If there are a lot of cud balls evident in front of the cubicles, then it's really important to try and improve the forage to concentrate ratio in the diet. If we're feeding wet acidic silages, is there some drier forage that can be mixed in, such as hay or bale silage, or even including a little bit of straw? A rumen buffer will also help reduce the risk of acidosis and help raise the rumen pH. Rumen buffers will be particularly important to correct that rumen acidity if it's difficult to make much changes to the forage type and concentration in the diet. The other thing that we can look at is rumen fill. So rumen fill gives us an indication of how well that cow has been eating over the last 2 to 6 hours. We can assess rumen fill on the left-hand side of the cow and looking at the area underneath the short ribs, in front of the hook bone and behind the last rib. Rumen fill can be scored from 1 to 5, where 1, the cow has eaten very little in the last few hours and she has a very hollow appearance underneath the short ribs. A cow with a rumen fill score of 5 shows that she's got a very good appetite, maximal feed intake and a fully distended rumen. We would expect to see dry cows with a rumen fill score of 4 and 5 when they're on a high fibre diet. However, with milking cows, we're aiming for cows to have a rumen fill score of round about 3. With a rumen fill score of 3, then the skin underneath the short ribs should drop down vertically for about a hand width and then start to bulge out. It won't be unusual for cows in the first week or 2 of lactation to have a rumen fill score of 2, and they'll have a slightly hollow triangular appearance, often called the warning triangle. Rumen fill can vary throughout the day and it will be influenced by the timing of feeding. Therefore, when looking at rumen fill, aim to score the cows at different times of the day to try and get an accurate assessment of how good rumen fill is within the herd. But if there are many cows with a score of 1 and 2, then those animals should be closely monitored for any signs of ill health. Low rumen fill scores may also be due to overstocking and insufficient feed space. Body condition scoring is a great way of assessing whether there is sufficient energy in the diet, and also that will be linked to feed intake as well. So the aim for a cow at calving is to be in a condition score of between 2.5 to 3. And ideally, we don't want cows to be losing more than half a condition score unit in early lactation in the first 2 months. So there should be no cows in the herd under a condition score of 2. Another good indicator of general health is just looking at the condition of the coat. So the coat should be shiny and smooth in appearance. So protein, vitamins and minerals are really important for healthy hair growth. For animals that have a dull, rough coat, this could be a sign of undernutrition and perhaps even a vitamin or mineral deficiency. Other things that we can look at to assess nutrition are some indicators in milk. So milk urea will give an indication as to whether there is sufficient or deficient protein in the diet. The target is for milk urea to be between 0.02 to 0.03%, or 200 to 300 milligrams per litre. A high milk urea can indicate that there is excess rumen degradable protein in the diet, and this is often seen when cows are grazing lush spring grass. If the milk urea is low, then that can indicate that there is a protein deficiency. But it's also linked to rumen available energy. A high milk urea can also be a sign of not enough rumen available energy in the diet, particularly if the milk protein percentage is slightly on the low side. We can also look at the fat to protein ratio in the milk. So the ideal ratio is 1.27, and that's calculated by dividing the milk fat percentage by the milk protein percentage. If that ratio is up towards about 1.4 and higher, that can be a sign of ketosis, so a severe lack of energy, and cows are mobilizing body fat at excessive rates. The opposite is true with acidosis. We'll tend to see a much lower fat to protein ratio, so much lower than 1.27. While good feed trough management will not make up for any nutritional deficiencies in the ration, it is important that cows have access to feed nearly 24 hours a day, have regular push-ups, and that the feed pass or trough is cleaned out daily. This is to ensure that we maximise dry matter intake to help optimise milking performance and maintain body condition as best as possible. There are a number of visual indicators that we can use to assess the adequacy of feeding in the milking herd. If you have any concerns, do take advice from a nutritionist and make sure that any nutritional advice is based on recent forage analysis. For more information, there is a detailed fact sheet available on the FAST website on this subject.